Can bipolar hypomania be mistaken for peak performance? Imagine feeling unstoppable, full of energy, and incredibly productive. It might seem like you're hitting your best stride, but sometimes this feeling is more than just a good day. It could be hypomania, a mood state linked to bipolar disorder that can look very much like peak performance. Hypomania involves an elevated or irritable mood, increased activity, and a sense of heightened confidence. During these episodes, people often experience a surge in goal-directed behavior, rapid thinking, and physical energy that can make them seem like they are performing at their absolute best. This state can lead to behaviors like pacing, fidgeting, or pushing physical and mental limits without feeling tired. Some research even shows that, during hypomanic episodes, individuals can temporarily increase their aerobic capacity and effort levels, even without formal training. This can give the impression of extraordinary productivity or creativity, which might be mistaken for peak performance in everyday life or work. From the outside, hypomania can look like someone is thriving. They might seem more confident, motivated, and quick-witted. The behavioral approach system model explains that people with bipolar disorder are often hypersensitive to cues signaling rewards, which can trigger hypomanic episodes marked by intense goal striving and motivation. This can create a false impression that they are functioning at an optimal or even superhuman level. But it is important to understand that, unlike true peak performance, which is sustainable, controlled, and adaptive, hypomania is a mood episode that is part of a mental health condition. It can quickly escalate into full-blown mania or switch into depression. While the initial feelings of increased energy and productivity can seem pleasurable, they often come with impaired judgment, reduced need for sleep, and risky behaviors. Over time, these episodes can cause problems in relationships, work, and daily life, especially if left untreated. Clinicians distinguish hypomania from peak performance by looking for specific signs. Hypomania involves a noticeable change from a person's usual mood and behavior, lasting at least for days, and causing observable changes that are not typical for the individual. It may also lead to negative consequences, like reckless decisions or strained relationships. Because of these risks, professional evaluation and treatment are essential. Treatment often includes therapy and medication to help manage symptoms and prevent episodes from worsening. In summary, hypomania can mimic peak performance because of the increased energy, motivation, and productivity it brings. However, it is a symptom of bipolar disorder that carries potential risks and instability. Unlike healthy, sustainable peak performance, hypomania is a temporary, often disruptive state that requires medical attention. Recognizing the difference is crucial for proper diagnosis and effective management. If you or someone you know experiences these symptoms, consulting a healthcare professional is the best step toward understanding and treatment.